Hello, hello. Listen, do you want to live longer, like save money, feel better, just overall, or just in better health? Absolutely, you do. Like, I know people are like, sign me up. A lot of people do, but did you know there's no magic pill and there's really no secret? It all comes down to preventative medicine. That's right. That's it. And that's what I'm going to talk to you about today. And it's not a super complicated thing. So that's what we're going to talk about today, how we can simplify preventative medicine and then put these things into place so that way you can have all of these wonderful benefits. You say, well, who are you to tell me? Well, welcome if this is your first time. I am Dr. Ashley Booth. I am a board certified family medicine physician. I'm the owner of a clinic called Healing Beyond the Stethoscope Primary Care. And I also provide you with these health tips and tools that you can use in your everyday life. So if that sounds like something that you want to continue to have in your life, then go ahead and subscribe. If you haven't already done so, turn on your notification bell. But then we also believe that sharing is caring here. So share and let other people know, because I know for a fact that this can revolutionize some things for people and make some changes, because we all want to save money, right? So, what the heck is preventative healthcare in the first place? What does that mean? It really means what is in that name. It is to prevent disease from happening or even getting worse. That's what prevention is, especially when it comes to medicine. And your primary care doctor are the main people who are focused on that. And that is what we do. And how we do that is either you do like some screening tools and you get together with your doctor and they talk about the different things that they need to do, or you also can change some behaviors. And that's the things such as like smoking and what does your diet look like and exercise, all those things. We've talked about that a lot. So I'm going to go into more detail about the screening things and how you can partner with your doctor to really get the things that you need done. Because the biggest misconception that I have gotten from people when it comes to screening tools is they say, listen, I don't have any symptoms, so I really don't have a problem, right? Or I'll have it checked when I do have a problem or when something shows up. Well, when you have a problem, then that goes from screening to a diagnostic tool. And that essentially means it goes from essentially free to now it has to cost you. So, like I said, we're going to save you some money today. And how we do that is with prevention. And depending on the type of insurance that you have, there's different types of screening things that they say. If you do a screening, then we will go ahead and pay for it, because we know in the long run that's going to save us money, right? So when we talk about saving money, that's the thing. So when you think about if you should do something and if it's a screening or a diagnostic, if you have no symptoms, no problems, no concerns, then that means a screening. So you have screening tests. I'm going to go into a couple of them, like you have a mammogram or a colonoscopy. You don't have any symptoms, you don't feel any lumps, you haven't noticed any changes. It is just time for you to do it. And then they will check and see if they see anything there. And if it's early enough, they can detect it and they say, oh, we need to do something about this. That is the point of any screening tool or test. And hear me when I say this, and what I tell everyone is the reason why we screen is because we're going to do something. So I have some people saying, I don't know. Listen, if someone finds something in your body and they say, we found it early, do you want us to do something about it? And you say yes, then you should do a screening. That is why, and that is how to make a screening tool the most effective, is because I have no issues or concerns. Everything is fine. However, if they find something early, I want them to do something about it. And think about that with anything when it comes to your body, when your doctor gets any labs and all that kind of stuff, because when we do that, it says if something comes back, then we need to do something about it. So, do you want people to do the things to help get it under control? So, that's the way you want to think about screening tools versus like a diagnostic. And again, if it is screening, it's most likely going to be free because it can be covered under your insurance. Diagnostic, that means that you're going to have to pay for it because it says there's a problem. So, you're going to have to pay. Okay. Now, let's look at the benefits of a screening tool or some of these preventative things, right? Like I said, we can catch the disease early. If we catch it early, we treat it early. And know what that does? It's going to make things cheaper for you because you are going to save money. Because we talk about like cheap versus expensive. Let's look at it this way. Let's say, for instance, there's a high blood pressure. Because one of the things is people say, well, I don't want to take medicine. And I hear you. And I know we're talking about prevention, but we also want to prevent things from getting worse, right? That's what I said. We want to prevent it from happening in the first place or prevent it from getting worse. So let's look at the example of high blood pressure. If you have high blood pressure, you probably have to take one or two medicines, depending on what's happening, right? So the easy thing is to take that one or two medicine. That's the cheap thing. The expensive is if you have a heart attack or stroke. And you know why that's expensive? Because if you have high blood pressure, more than likely you're probably only seeing one doctor who's keeping that under control and making sure that you're fine. You have a heart attack or stroke, I know for a fact that's going to buy you about two or three more doctors, and it's going to buy you about three or four more medicines. So we have our cheap versus expensive. And not only does it becomes more expensive with like the doctors that you have to see, because then that's more costly with specialists and stuff, but then you also have that time expense because now you have to split your time and go see more people. You have that medication expense because now you have more medicines. So when we talk about saving money, you still can save money even if you've been diagnosed with something, because if we prevent it from getting worse, that also is going to help you save money. So you're going to stay healthier, you're going to have a better quality of life, and ultimately that is going to lead to longer life. But how does that happen? You have to make your health primary with your primary doctor. Specialists will not do it. Your specialist will keep track of certain things, but your primary is keeping track of the whole picture. They have that entire checklist of all the things that they need to look at to make sure that you're okay. So you want to partner with your primary doctor, okay? And they're going to do what I call your annual checkup. And with that checkup, there's a checklist. And there's a lot of things that they're going to look at on that list to see if you are up to date. And if you are an adult and you don't have any medicines that you are taking, like you don't take a medicine, you should see your doctor at least once a year if you're not on any medication. So you're going to go in for your checkup, which has a little checklist to see if you're up to date. Now, again, who qualifies for this annual checkup and physical, and how does that work? If you don't have any symptoms, you feel fine, you don't have any concerns, any problems, you don't want them to look at anything, I'm not having anything, no headaches, no stomach aches, no, oh, what about this? You're like, I'm completely fine, I'm good. I just want to go in and make sure that I am fine, right? So then that's where you can qualify for that physical or that annual wellness visit that's usually free with your insurance. And those are only free if you go through that checklist of the being up to date. If you get off track and say, "Oh, I'm also experiencing this and I'm having back pain and I'm having," then that's no longer your physical, your free physical. Some insurances are allowing you to have that free physical, but you got to look up and see what it covers and what's going on. But if they do, know that it is not about discussing all the things, and it's usually just going through the checklist to make sure that you're up to date in doing that. Well, what is on that checklist? First thing is your vitals. And vitals includes like your weight, your blood pressure, your height, all that kind of stuff to see. And you say, well, what does that have to do with anything? Well, that helps us to understand what we call like your BMI to see what's going on there. Your blood pressure lets us know, are you at risk for high blood pressure? Do we need to start putting things in place to make sure that it doesn't get higher? All that kind of stuff. So we can tell a lot from your vital signs. And then the next thing are your labs. And some of the basic labs that it will include, like your complete blood count, seeing if you are anemic or anything. But the other ones is your A1C, and that's looking to see if you're at risk for diabetes. It can be a BMP or CMP, which is basically a metabolic panel, looks at your liver and your kidney function, looking at your cholesterol and see where you are there. And then a basic urine. Urine tells us a lot, and not just an infection. Urine can tell us your kidney function, it can tell us whether or not you have diabetes, all that kind of stuff. So those are some of the basic labs that's on that checklist. Other thing, vaccines. Are you up to date with flu and pneumonia, shingles? Depending on age and risk factors, They're going to look at that. Colonoscopy. If you are over the age of 45, then a colonoscopy is another thing to look at on your checklist. Men, if you have, whether or not you've had a PSA, and the PSA is one of those that's kind of, lack of a better term, controversial, and it's one of those where it's just you want to have that discussion with your doctor to say, should I still be getting a PSA? What's the point of having it? What are we going to do with that information? But you need to have that discussion with your doctor about that. For women, you want to also look at your pap smear and your mammograms. How often should you be getting those? That sort of thing. So that is what your annual preventative checklist should look like. And you want to partner with your primary care doctor in order to be up to date on those things. And I say your primary because your specialist just doesn't have the time to go through all of those things. Some of them will try to do a few things, but they are also probably not likely up to date on what are the things you need to be up to date on. Like I just mentioned, all of those things, your vaccines and all of that. So they may not be aware of what the new guidelines are. And that's just not what they do. They are specialized in whatever that area is that they're supposed to take care of, and they want to make sure that you are up to date in that area. But your primary is supposed to look at all of you and make sure that you are well. So if you do not have a primary care doctor, or you are in need of a primary care doctor, like, oh, I need a new one, whatever the case may be, look us up. We are still accepting new patients and we would love to serve you. Our information is on the screen. You can go to our website, check us out. You can also enroll there, or you can give us a call. Again, that information is also on the screen. But we still want to connect with you because that's what we do. And we do a comprehensive physical. So we sit down and we go through that checklist, but we also talk about you and who are you and how does life work and look for you. So that way we know how to make all of this make sense. And then we sit down and we talk about it. Because when was the last time you went to your doctor and they sat down and said, these are your kidneys right here, and this is where you are, and this is where you should be? When you get your labs back, do you know what all of that information is? They said, yep, we checked everything and everything is fine. What's everything? Because everything to me could be totally different as in everything to you. Because did they check this? Oh, I thought they did. Oh, I thought. Well, then you will know, because you will have someone who will sit down and say, these are your kidneys, this is your liver, this is what's happening, and this is where we are. And then this is where we are headed. And if we put these things in place, then this is where we're going to be. So you not only want to be equipped with that information, but you also want to be able to have a plan and say, okay, this is where we are headed and this is where we're going to go, because that is how you save money, you live longer, and you feel much better and have a healthier life. So if that is what you're looking for and that is what you need, be sure to look us up, or also make sure that you partner with your primary care doctor. But until next time,